Ready? All right. Welcome to my presentation. Merry Christmas.
Merry Christmas!
Merry Christmas.
I've completed 1 semester of medical school and I'm already better than you. A peer-reviewed Christmas presentation. Thank you for joining me today. I'll be speaking exclusively in medical terminology because I've been in med school long enough to forget how to be normal. Disclaimers, some red flags that you need to know about. I am not a doctor. I feel like one. Confidence is at an all-time high, but my knowledge is questionable. Legally, I know nothing. Emotionally, I know everything. Medical terminology, why? There's no reason. Medical terminology exists to confuse patients, impress family members, avoid saying in front of a patient, and feel superior at dinner parties. Medicine could be simple, but instead we chose vibes and confusion. Basically, medical terminology is when you take a normal word, make it longer, and suddenly everyone trusts you. For example, tummy ache becomes abdominal discomfort, and now insurance covers it. Some prefixes. Hyper, too much. Hypo, not enough. Tachy, fast. Brady, slow. With these 4 prefixes, I can diagnose anything. Heart fast, tachycardia. Heart slow, bradycardia. Anything else, probably anxiety. Some suffixes. The ending that makes it scary. Itis, inflammation. Oma, tumor, algia, pain, ectomy. Let's just cut it out. These are the suffixes that ruin someone's day. Basically, add itis to anything and people panic. Finals, itis. Christmas family dinner itis.
I can attest to that.
So, turning normal sentences into medicine. Normal, I'm tired. Medical school, I'm experiencing chronic fatigue secondary to excessive educational exposure. Normal, I forgot. Medical school, acute memory deficit of unknown etiology. This is kind of how medical school works. Nothing really changes except the number of syllables. Here's some anatomy terms that ruined my life. Anterior, front, posterior, back, medial towards the middle, and then lateral towards the side. I can no longer say left or right without panicking. If you ask me where something is, I need at least 3 landmarks and a body axis to figure out where it's at.
Triangulate.
My favorite diagnosis. Acute med student-itis. Symptoms, excessive caffeine intake, saying pathophysiology for no reason at all, explaining things nobody asked me about. Treatment is holidays, living on loans, and Christmas cookies. It's very common this time of year. Unfortunately, sleep is contraindicated. Prognosis is poor until summer, but vibes are stable. So, a lot of us have had this problem where we go and see a doc and they give us a diagnosis. We have no idea what they're saying. So I tried to translate it to each generation. You'll kind of give me some feedback. So first, for boomer medicine.
That's you
Heart
guys.
disease.
That's us.
My ticker's running like a lawnmower with bad spark plugs. Doctor says, cut back on bacon. I say, cut back on doctors. Heyo. Hearing loss. Grandkids yelling, Grandpa, me, who's Amanda? Cataracts. Vision fuzzier than a rabbit ear antenna in a thunderstorm. If these don't make sense to you, you're just in the wrong generation. Inflamed prostate. Bathroom trips every 20 minutes. It's like running laps at the Indy 500, except the pit stops are all in the hallway. Boomer medicine is very evidence-based. The evidence is feelings, stories, and that guy from work, you know. Millennial medicine. This is us. Depression. Work-life balance is a myth. Corporate says we're a family, but it's given unpaid overtime vibes. Carpal tunnel, wrist fried from 20 years of typing angry emails, swiping left, and doom scrolling on Twitter until 3 a.m. Infertility, reproductive system said, nah, we're focusing on career goals instead. Eggs are basically NFTs, rare, confusing, and probably worthless. And then IBS, trauma lives in the gut. Millennials don't have diseases, we have subscriptions, coping mechanisms, and 3 unfinished podcasts on wellness. All right. I tried, guys. So you're gonna have to give me some feedback. All right. TikTok medicine. Social anxiety. POV, you try to rizz up the cashier, but confidence collapses like a Jenga tower. Huge dub if you even say hi.
Whoa.
Vaping lung irritation. Respiratory system rating itself a solid 6-7. Delulu lungs given decay, not slay. Vitamin D deficiency. Doctor prescribing touch grass IRL. Put the fries in the bag and step outside, bestie. Sleep deprivation. Me binging TikToks at 3 a.m. Brain, we ball. Immune system, we fall. Low key, my melatonin is rage pressure. Gen Z and Gen Alpha don't go to the ER. They make a video on TikTok. It gets 100 likes. It's considered an autoimmune. Basically, this is my conclusion. Thank you for attending my very legitimate medical presentation. I will now take questions and answer them incorrectly. In conclusion, I don't know much yet, but I sound like I do, which as it turns out is 90% of medicine. Merry Christmas.
Merry Christmas!
So,
Good job,